Right. Hi, everybody. Welcome to the webinar. Um, I must say, I've been quite looking forward to seeing lots and lots of physios in South Africa. I've just arrived back in South Africa. I'm living in Dubai at the moment, but I've decided to escape the heat in Dubai and to rather come and stay in South Africa for the next 3, 4 months. And then I decided, since I'm here, I can just as well present the course this year in Johannesburg. And this is also part of why I want to introduce the course to you and the book to you and everything that's happening in the Lyno Method at the moment. So let's just start, or for those of you who don't know anything about me or the Lyno Method, I'm just trying to see my own slide here. So I qualified as a physio in 1982, so a long, long time ago at the Free State University. And for the first about 9 years, I worked in Cape Town. First, I worked in a spinal unit for a year, and then I worked in the military hospital in Wynberg for 4 years, where I was seeing all these soldiers who were suddenly put into heavy boots and suddenly put into heavy training and overtrained completely and had numerous chronic and recurring sports injuries. So after 4 years in the army hospital, I then moved over and started my own practice. And when I opened the practice, I made it very clear to all the doctors around me that they must please send me mainly sport, because this is what I've been doing for the previous 5 years. And then in 1995, I moved to Stellenbosch because I was seeing a lot of athletes who came from Stellenbosch to my Durbanville practice, and they asked if I would open a practice in Stellenbosch. And then it became a complete sports practice. So I remember I used to say to my secretary that when anybody calls to make an appointment, she must first ask them how many times a week do they train. And if they don't train at least 5 times a week, then they shouldn't come to my practice at all. Then there were 14 other physio practices in Stellenbosch, but I really only wanted to see the serious athletes. So then in 1996 was the Atlanta Olympic Games. And at that point, I was working with a lot of the Olympic athletes from South Africa, but also a lot from abroad who came to train in South Africa in the Southern Hemisphere because it was winter in the Northern Hemisphere. And one of these athletes that I saw in 1995 who came to prepare for Atlanta was Kelly Holmes. And she was a British 800, 1,500 meter athlete. She's won the Commonwealth Games before, and they were adamant, or they were very sure, that Kelly would definitely win at least the 1,500 at the Atlanta Olympics. So they brought her to South Africa together with a BBC team who was filming absolutely everything, her training, and they were filming all her physio sessions and all her social sessions, etc. So I was standing in the practice one morning, and then the door opened. I was in the waiting room, and this athlete walked in. I didn't know her at the time, and next to her was this BBC lady with a big television camera. And they were filming this girl introducing herself as Kelly Holmes and saying, "Benita, I just want you to know that apparently you are the athletic physio in town, and you will be my physio for the whole, about 5, 6 months that she was preparing for the Olympic Games." Anyway, so there I was with Kelly, who came to South Africa with a long, long history of chronic injuries. But because I was always working in sport, seeing the same old injuries all the time, it was actually not that difficult for me to keep her sort of, in a sense, out of injury. So every time anything flared up, the BBC cameras would be there asking me, "What's going to happen now? Are you going to fix it?" etc. So the pressure was very high. But I managed to actually keep her in a trainable condition all the time. So off she went to the Olympic Games. But as it happens, the moment they sort of experience that stressful situation of now the pressure is on, she's got to win this medal, then the injuries always came back. So it always came back at the times when they really, really did not need these injuries. And this is exactly what happened to Kelly. Is in the semi-final, she started feeling a lot of pain in her lower leg. And by the time she got to the final, she already had a tibia stress fracture and she came fourth. She didn't even get a bronze medal and she was extremely upset. So shortly after that, after the Olympic Games in 1996, I was also looking at Ilana Meyer at that time, or after Ilana Meyer, who was our marathon athlete who also got injured and didn't get her medal at the Olympics. So I sat with Kelly and I sat with Ilana, and they were saying, listen, whatever you do was great, but it doesn't actually work. It doesn't keep us out of injury, because when it really becomes quite important, then they get injured again. And this is what Lyno became all about, is I wanted to find a way or determine, or what could I do to get rid of chronic pain, or to get an injury not to become chronic or not to recur all the time. So on this slide, you can see there is the whole dilemma. Your client has been in pain. They've been injured for 6 months, 2 years, or for decades even. You treat them and it works because we've got good modalities and good techniques. They improve, but then they come back. A month later, a year later, whenever, they come back with the same pain or the same injury, or sometimes they come back with not the same injury, a different injury, but they keep coming back with injuries. And those are the difficult clients, the ones that you end up seeing over and over and over again, and it becomes very frustrating. So now the interesting thing here is that we know in physio that soft tissue heals, it takes 3 to 6 weeks to heal for soft tissue. We know bone heals in about 12 weeks. So then if the soft tissue has already reached that 6-week stage, then surely then the tissue has healed. Or if the bone has reached the 12-week stage, or say, let's make it a little bit longer, we know the bone must be healed. So why do they then come back with the same injury? And it's only when I started to develop the Lyno method that eventually I realized why they are coming back. And the whole thing, the way we look at it in Lyno now, is not to look at what is the pain, how can we diagnose it, what treatment are we going to give it, is it pain, is it swelling, etc., etc., is it weakness, is it tightness, do we need to stretch it? We're not looking at it from that angle, the way we normally look at it. We look at it through a completely different filter. So what we realized is that if you have a stressful situation, a traumatic situation, whether it is an emotional traumatic situation, somebody dies, you're going through a divorce, you have a very difficult boss, you lose your job, some emotional traumatic situation. So whether it's that, or whether it is a physical situation, you sprain your ankle, you fall, you are in a car accident. So any traumatic kind of situation, the first thing the nervous system does to protect you is to brace in a specific position. So if you have sprained your ankle, the nervous system will immediately move the weight away from that ankle, and then it holds you in a bracing pattern that will keep protecting that. Now, if that bracing pattern stays there long enough, it becomes a procedural memory. Now, a procedural memory is like when you learn to ride a bicycle. So in the beginning, you have to really focus on what to do to keep the bicycle upright and to get moving on it without falling over. But very, very quickly, you just get it. And the moment you get it, it means that it's formed a procedural memory in the brain, and that means you don't even have to think about it. The nervous system takes over and will brace you in a position that you can ride the bicycle. Now, the same thing happens if you are in continuous stressful situation, whether it is an emotional stress, continuous, and you are pulling up your shoulders, or you are breathing in a certain way, or you are folding forward, moving forward to try and protect yourself from a very difficult situation, or if it is, like we say, a sprained ankle or an injury to the bone, etc., etc. The moment you brace for a certain amount of time, it gets saved as a procedural memory. Then you don't even have to think about it anymore. But every time you are in a situation that simulates whatever trauma you experienced before, the nervous system will automatically brace you in that same position. So what happens now if we are bracing and holding and contracting muscles in a certain position over a period of time? The fascia becomes restricted in those areas where we are bracing. And as soon as the fascia becomes restricted, it means then that it puts us out of alignment. And the moment the body is out of alignment, it means that certain muscles have to work harder, other muscles become deactivated. It also says that certain joints carries a lot more load than other joints. It will put your disc into a position that we get disc matter moving out towards the one side. So many different things can happen, which then becomes the chronic pain. So if you have a bracing pattern that became a procedural memory, then the procedural memory will cause continuous bracing. Continuous bracing will cause fascia restrictions, and fascia restrictions cause misalignment, and misalignment means now you are going to get chronic symptoms, and you are stuck in those chronic symptoms as long as the procedural memory is there and as long as the triggers are there. So the problem does not lie in the tissues, in the muscle spasm, in the pain, etc., etc. The problem lies in the procedural memory in the brain, and that's where we're going to have to actually deal with it. So now when we look at the current tools that we have, whether you are a massage therapist, a personal trainer, a bio, a physio, whatever, we have massage, right? We have massage, we have fascia release, we have trigger points, we have dry needling, all those things fall more or less in the same category. It will release whatever it is where you are applying it, but it doesn't change the procedural memory. So it doesn't mean that you are now suddenly not going to have that pain again. The moment the nervous system gets triggered again, it will just contract that area again. Your muscle spasm will come back, your pain will come back, your stiffness will come back, everything will come back, and you'll have to massage it again. So the massage helps, yes, but it's not going to go to where the origin really is. The same applies for stretching. Stretching will make might make the muscle longer for a moment, but tomorrow morning you have to actually stretch it again, because in the meantime, the nervous system has just contracted that muscle again. Manipulation, all the Maitland mobs and all the manipulative techniques that we use, it helps, it works, it corrects the alignment, but if there's a procedural memory that's going to kick in the moment you become stressed again or the moment you become triggered again, then the non-alignment will be back, and then you'll have to run back to your old techniques and you have to release it again. And then the last one, exercise, and I've put that actually in red because exercise to me is actually the most dangerous thing. When people come into a line of practice, one of the questions we ask them is, all right, tell me about all your current symptoms and all your previous symptoms, etc., etc. And we type that into our app. And then we ask them, okay, but what treatment have you had? And normally they would say they've had some physio, maybe they've been to an osteopath, they had massage, they've been to a biokineticist, so they've had lots of exercise, etc. And then we ask them, okay, but why do you think whatever treatment you had did not work? And then most of the time they say, oh, because the physio gave me some exercises and I didn't really do it. And then sometimes I think, thanks heavens she did not do it, because the exercises, the strength work that you do will be exactly in that misaligned pattern. So the way you are braced up with your fascia locked in a certain position, it's in that exact pattern that you will be doing your strength training, which means that you are actually making it worse. So in a sense, it's actually better not to do the strength work until we have corrected the alignment, until we have erased the procedural memory and replaced it with a new neural pathway. So what I'm saying here is that I was at that time in 1996, I wasn't missing a technique. I was missing a framework. And it was the moment that I created and developed a framework that I actually managed to get my clients better and to get them out of injuries. but not immediately. And let me get to the next slide and then I will tell you. Let me first explain exactly how Lyno works. So the most important first thing in Lyno is we need to understand in what nervous system state the client is. So now your athlete comes in and say, I have this chronic hamstring injury and I have to train, and you don't understand training is so important, and please just treat me, but don't tell me that I can't do my heel session tomorrow, or that I can't race in 2 weeks' time, or that. So if they come in and they are, I have to, then we know that they are in that sympathetic nervous system zone. That means that they are in the I have to. Adrenaline and cortisol is the main chemical sort of background in their body, and they are in continuous bracing. So if they are in continuous bracing within the sympathetic zone, or in the sympathetic nervous system state, if they're in chronic bracing, it means that they will have chronic fascia restrictions, and chronic fascia restrictions will keep them out of alignment, and that will keep the hamstring going. So it helps to know if they are stuck in that sympathetic zone, because then we need to first get them out of that zone, out of I have to, you don't understand, and get them into, okay, let me hear, what do I need to do to heal? So that nervous system state is important, because if we leave them in the sympathetic nervous system state, they are going to continue bracing. And if they continue bracing, we're never ever going to get them better. Or you might get them better for 2 days and then it will just come back again. So that's the one state. That's the difficult one. And then the other state, and this we see often with people who's been in emotional traumatic situations. Those are the people who are in the dorsal vagal state. And that is the state of almost collapse. And this is where the autoimmune diseases, fibromyalgia, the rheumatoid arthritis, all those autoimmunes, are the depression, all those cancer, all of that is in the dorsal state. And that's the state where they've given up and they've completely collapsed. But they also collapse in a pattern of bracing. And those people we need to activate and bring them out of the dorsal state, and then get rid of the procedural memories, get the body back into alignment. So it's just a different way of dealing with the you don't understand, I can't, compared to you don't understand, I have to. We need to get them all in the play zone where oxytocin is the chemical background of the body, and that's where we really can heal them. So then it's important for us to find out what actually triggered this bracing pattern. Is it an emotional trigger? Is it from long ago? Is it current? Is it a physical trigger? Was there an old injury? Or is it overtraining? Or what is it? So we need to find out what's triggering it. So this is us to understand what's going on. And once we understand, we can actually explain to them what the background of their injury and the background of the nervous system is. And then the very important and absolutely the essence of the Lyno method is we have now a digital goniometer on the Lyno application. So what we do is we literally measure them from head to toe, from neck flexion, extension, lateral flexion, rotation, all the way down to toe dorsiflexion and plantar flexion, all the way through to the arms. We do linear testing, we do spiral testing, and we find out with that test exactly in which way they are bracing. So once we know exactly what pattern they are stuck in, it already makes sense why they have the hammy injury, why they have the chronic headaches, etc., etc. But yet we are not going to look at the symptoms. We now have the pattern, and this is the procedural memory, and this is what we need to release. And the way that we release that has changed completely from the early days of Lyno. So those of you who have been around for quite a while will know that originally, Lyno's 30 years old this year. Originally, I would say for the first almost 20 years, we worked with very deep manual fascia releases, which was effective, yes. So we managed to get them out of their symptoms very quickly. And if I saw my elite athletes on a regular basis, I was always releasing them. I'd do the assessment. I know exactly where they are locked up. I release them and they can just carry on training and training and training. And they go on. Kelly won a double gold. Ilana broke the half marathon world record. So we managed to actually keep them going. But one thing that I found very, very interesting, and specifically with Kelly, was, so I've worked with her for 7 years, since the Atlanta Olympics. And for 7 years, I kept her injury-free. But very interesting, I have seen her almost every week and almost twice every week for that 7 years. But every time I saw her, she was locked in the same pattern. So I unlock the pattern. She walks out of there. She can go and train for 3-4 days as hard as she wants. Then she comes back for what she called a massage. I did the assessment, found the same pattern. So even if she would complain of an Achilles originally that was sore, or a stress fracture or whatever, the pattern that I found was never in the area of the symptoms. The pattern was always somewhere else. So I released the pattern and then the symptoms went away. So as I, over 7 years, released the pattern every time she comes into the practice, she actually never ever get the symptoms and she managed to win her double gold. It was quite interesting during those years. I remember I was working with Josiah Tugwani, who won the gold in the marathon at Atlanta Olympics. So he developed a hamstring injury later, and then I started to work with him. And then Josiah realized that he used to come down to me every now and then so that I can just make sure that he doesn't get injured. But he used to send a lot of athletes from the north, from Limpopo and that, people that he was working with. He would send them down to me, and then he would say to these athletes, don't worry, she's going to treat the wrong injury, but she will fix you. So I became known as the woman who treats the wrong injury. You have knee pain, but she treats your shoulder, or you have foot pain and she treats your neck. So whatever, don't worry about what she's treating. Just know that she is going to fix you. So that was the whole thing about the deep fascia releases, and the athletes loved it. I mean, they made those red stripes, but they loved it. No pain, no gain. It was amazing. But what was so interesting, after Kelly won the double gold at Athens Olympics, she went back to England, decided she's going to retire. And then it was about 4 or 5 months after the Athens Olympics. At Sheffield, they had I think it was a Grand Prix athletic meeting, and then they specifically invited Kelly to come and run a kind of a victory race there, the 1500 victory race, just for the UK, the British public, to see her for the last time. So I flew all the way up from South Africa to go and watch Kelly run this final 1500 in Sheffield. But when I got there, she couldn't run at all because she had her old Achilles injury again. And then she said, I haven't been training at all because I've been struggling with this injury. And interesting, that's when I started to think, it's when I was able to release the locks all the time, she never got injured. But now she's not seeing me anymore. She's actually back to seeing her physio who's treating her Achilles, and she ends up, she can't run at all. And that already started to make me think, isn't there something else? What is then causing the fascia to become locked in that area all the time? And it's only when I started to ask those questions over the past 10 years, and I started to read about Porges's vagus theories and all that, when I realized that if there's a procedural memory in the nervous system, and the nervous system sees Kelly is going to train hard again, immediately it braces up. When it braces up, it causes that restriction that I normally used to get rid of. And once the restriction is there, then the symptoms show up. So if we go to the nervous system and not to the fascia restrictions, we're actually going to fix this at the core where it all started. So how do we do that? And that's when I realized, and I was actually in South Korea, I think in 2019, and working with 20 physios there, teaching them the Lyno Method. And when I arrived there, they were all very much in their long T-shirts all the way up to the wrist, and in their long pants all the way up to the ankles. And when I started to show them, I want to show you on your skin, doing the deep technique at that time, they all looked at me and said, no, this is not going to work. They're not going to take their clothes off and then wear a spaghetti strap top or anything. It doesn't work like that. And then I realized, oh my goodness, what am I going to do? Because here I've flown all the way to South Korea, and how am I going to show them the technique? So then I said, okay, well, in that case, I'm going to just move over your clothing to show you in which direction I would have done the technique. And then I added movement, opposite movement, almost like a stretch. So the movement would be the same as my test, where I test for their flexibility. So say now I would work with horizontal extension of the arm. I would make them move into horizontal extension, and then I would move my hand over the clothing like that to show them this is what I would have done. And I just did it very gently because this is what they wanted, gentle. And then I realized, but it's actually releasing as well. And that's when I started to think, but what am I doing? I'm not actually doing the manual releases. I'm just doing the movement, the focus in the area. And we did about like 5 movements, and we started to get the releases, which we don't even get when we are doing stretching. And then when I went back to South Africa and I started to read up about it, at the same time, Porges' stuff came up, etc., etc. And then I started to add breathing to it. And the more and more I did that, the more and more I realized that if I add the breathing and I bring them from that sympathetic, I have to, I'm bracing up zone into that complete relaxed state, and I combine that with a movement and with the proprioceptive cueing, because now it wasn't manual release on the skin or anything. It was really just cueing the nervous system. This is the area. It's safe to move through here now. And if you do that with a very long breath and a very gentle breath, then 5 strokes and it releases completely. And now it was interesting. So now in the meantime, I've developed the app. And so we have on the app with a digital goniometer, we now record all the measurements from the head all the way down. And the app then is built with algorithms. So it will show us exactly in which pattern they are locked up. So I would see them today. I would do the assessment. I can see the pattern. I can see exactly how many degrees of horizontal extension I need, how many degrees of neck flexion or whatever I need. So I can see exactly in the degrees how locked up is the pattern. I do the releases exactly of that pattern in this very gentle way now. I send them home and ask them to continue with the releases, not to go do exercises, but to continue doing the breathing and the specific movements. So we are now creating new neural pathways. And when I teach them that, and they come back after 3-4 days and I do a reassessment, sometimes there's the same pattern, but a lot less. So say now, neck flexion should be 50 degrees. Last time they were like 25. They now come in and they are 40 degrees. Or they come in and the pattern is completely different. So where last time it was neck flexion that was an issue, this time it's neck rotation towards the left that is an issue, or wherever in the body. So it could go from this pattern to something completely different. So if it's something completely different, then I know that the previous pattern was a pattern related to a quite recent injury, whether emotional or physical injury or trauma. So once I released that, the previous thing showed up. And this is why people sometimes come in and say, I used to have hip pain, but that's fine. And then I got plantar fasciitis, but they gave me orthotics for that. And ever since I've got the orthotic, that's fine. So you don't have to touch my foot. But now I'm struggling with the shoulder. So now I do the assessment. I find the pattern, release the pattern. They come back, they say the shoulder is so much better, but now I'm stuck with that plantar fasciitis again. What have you done now? And I used to struggle with the plantar fasciitis. I take the orthotics out, I reassess, I find a different pattern. So we're peeling the onion layers. And this, as physios, we know this quite well, peeling the onion. So I'm peeling another layer off and I see something completely different. And when I release that, they might come back and say the plantar fascia is fine, but now I'm struggling again with that old hip. Then one session later, different pattern. we come down to what we call the base pattern. Now, when we are little, up to about anything between 7 and 12 years old, we only respond really to the vibration we get of others. So young children, and they've done loads of research about that now, young children will always associate with either one parent or one caregiver. Watch us carefully how that parent or caregiver responds to stress. And the child then mirrors and mimics exactly that pattern, and that becomes the brace pattern. So often, I remember in Dubai the other day, I was sitting there with one of my clients, actually one of my athletes, and there was a father and a little boy, I think he was about 2.5 years old, walking past us, and the dad was walking with shoulders completely forward. And the little boy was walking in exactly the same way. And I said to my client, can you see that? That child is obviously mirroring his dad. So when the dad becomes stressed, he flexes forward to protect himself, and the little boy is mimicking exactly that. So if we work with children, it's actually quite important to work with the parent or the caregiver who is giving them that stress response, or who is programming them with that stress response. So as I say, eventually, as we've removed all the layers, we get to the bottom layer. And this is why, so say on the 4th session, we see this layer. On the 5th session, we see the same layer. It's a lot better, but there's still the same layer. And on the next session, maybe a month later, they say, oh, they're so much better. But we still see a similar layer there, although a lot less. And that is the base pattern. That is the pattern we've been programmed with when we were very, very little. And once you have the base pattern, then you can give them almost like a little recipe of whenever you start getting a headache, or your back gets sore out of nowhere, or you suddenly get ITB pain when you are running. Whenever you get any new spontaneous kind of pain, go back to the releases that I've given you as homework on the last session, because the moment you become stressed for any reason, you will brace up first in your base pattern. And if you can catch it at that point and release it by just breathing out and doing that movement that I've given you, you're actually unblocking yourself immediately, unlocking that procedural memory before it actually becomes a chronic procedural memory again, and you are in a neutral space. So that's the whole idea, is we want to get all our clients to become independent so that they can manage their own stress responses and their own bracing patterns, only if they've had a major accident or event, etc. And they come back and they say, Benita, I feel so stressed. You really need to help me with this. Then I do a full assessment again, and then I might need to give them 1 or 2 or 3 new release exercises. So this is how we work. We want to get our clients independent, and then sometimes the new let me just see, someone's in the waiting room. Okay, so then when we some of the new practitioners sometimes say to me, but I don't want the people to get so much better that they don't come to see me again. But the nice thing about getting people so much better is that they're going to tell all their friends. If you don't want to go to someone like 20 or 30 or 40 times and the injury keeps coming back and back, then go see them, because they might see you 5 times, they might see you 10 times, they might see you over a matter of 6 months, they might see you 15 times, but we're going to get to the core of it, and we are going to enable you and make you independent so that you can manage your own chronic symptoms or prevent your own chronic symptoms by doing it all yourself. So, is this method for you? Should you be doing this? Yes, it is for you if you have chronic pain clients. If you have chronic pain clients that keep coming back, or chronically injured athletes or sports people who keep coming back, if you're going to use this method, you are going to help them to resolve their problems. If you suspect the nervous system plays a bigger role in many of the clients that you see, then this is for you. If you want lasting results and not just symptomatic relief, then this is for you. If you are ready to do a lot of case study work in between the modules, then this work is for you. This is not for you if you want a hands-on manual and manual techniques only. We do not do manual techniques. So if you want something that's just another tool in your toolbox that you can just apply, if this one didn't work, let's try this one, then this is not for you. Because as I said in the beginning, I'm teaching you a framework. I'm not teaching you a technique. I mean, there's no breathing, really. We all know how to do proper breathing if we are physios. The movements is really very, very basic movements, and just showing the cueing there is very basic. So there's no new fancy techniques, but there's a framework that shows you exactly where you need to focus to get rid of the individual's problem. I mean, I wrote an article many years ago for the first fascia conference, and I said there, it was interesting, if you would give me 10 hamstring injuries, 10 left hamstring injuries, or 10 people with left hamstring injuries, I can guarantee you that if I do the assessment on all of them, it will all look different. And my treatment focus for all these people will be completely different. So whereas in physio, we would learn, if you have a hamstring injury, this is what you stretch, these are the modalities you use, this is how you strengthen, etc., etc. There is a set recipe for that, which works, but maybe they come back, or maybe it doesn't work at all. What I saw in Lyno is if you take 10 hamstring injuries and you do the full assessment, they all look different. So you can't use the same recipe on all of them. And that was what to me was so interesting. So then the last thing, this is not for you if you are not currently working with chronic pain clients. Right. Then what will you master when you do the Lyno courses, when you come to the Lyno course? The first thing is we will teach you how to assess the whole body. So we are not going to look at where the pain is or trying to give it a diagnosis or a label or anything. We are going to show you how to assess the whole body to see where they are bracing. If you are going to work with very active people and athletes, we are going to teach you the Bunky test. And the Bunky test is a core test where we test the core of the front, the back, the lateral, and the medial. So all the different planes of core to see which part of the core is activated and which is not activated, because that shows us the degree of non-alignment. So the Bunky test we use a little bit as for exercises as well for athletes, but it's mainly an outcome test. So we would do the Bunky test on an athlete on day one. And even a professional, I was so now in Dubai, I worked with professional triathletes, and they would come in and they've had a chronic ankle that they're struggling with, but they strap it up and they're on orthotics, so they seem okay. They don't get any pain when they're running, but they can't push their running, and then they end up coming to me. When I do the Bunky test, they've got bunkies testing out of 30, 8 out of 32 out of 30, some 30 out of 30. And then they're so shocked because they're in the gym all the time and they are so strong in the gym. And how's it possible that my Bunky test shows that there's big gaps in their core? And when we then do the full assessment, then we can see exactly where they are locked up, which is causing non-activation of a lot of the core muscles. And that's why the Bunky test shows up badly or bad results. So once we release that bracing pattern and we get everything to become activated again, and then 2 sessions later we retest the Bunky test, all of a sudden they can do all the bunkies. And then they are so excited and surprised because they haven't actually been doing any specific core exercises, but it's only because through doing the full assessment and by releasing the bracing pattern, we actually help to activate all the other muscles and then not only get them out of their injury, but also up their performance. So often people would come to us and they say, I've been training for how long, and I've got a new coach now. I've tried everything, but I'm just not ever getting stronger or getting faster. I'm just never, ever improving. Then we test them. Interesting, most of those people, you do the Bunky test, and the Bunky test seems fine. I mean, there doesn't seem to be any issues there. They've also not got any symptoms. But then we would do the assessment of the body, and we find a lot of locking. So a lot of overtraining and that. And the moment we start releasing that, initially the Bunky tests start dropping and showing up all kinds of issues. And then we keep releasing until the Bunky tests lift up again. And then all of a sudden, everything is activated, and then they start performing a lot better. So we use the Bunky test mainly as an outcome test. Then you will also learn how to use the Lyno app with its digital goniometer. Now, on the Lyno app, we do the full assessment, subjective assessment, so we can type in all the answers of where the symptoms are, what their old triggers are, what the nervous state is, what kind of shoes they wear, what kind of training they do, etc., etc. All of that we type in on the Lyno application. And then we have the goniometer, which will show us exactly in how many degrees they can move and how many degrees they cannot move. And then the Lyno app then uses algorithms to show us then and give us a treatment plan that shows exactly what the pattern is that they are locked in. And all this information then gets stored onto the cloud. And when the client comes in the next time and you retest them, then you can swipe and see last time neck flexion was this time neck flexion is like that. So you can actually run through the whole body and see exactly how the patterns have changed and exactly where you have to work this time. So then the next thing is we will teach you how to do the breath work that we use in Lyno, how to do the movements, specific movements for each and every of the 50 tests, and then how to also do the proprioceptive cueing for those movements. And then for those of you who've maybe known Lyno from previously, we still use the yellow page wedge technique that was developed by chiropractor Ron Holder many, many years ago. So now I don't know, I think most of you are very young, but when Zola Budd was this little barefoot runner way, way, way back in the 80s and in the 90s as well, then Zola got a hip injury, and the person who actually got her out of that hip injury was Ron Holder. And Ron was a kinesiologist and a chiropractor. So what he developed then was he looked at the feet and he said that if you are out of alignment, you are not going to stand on your feet in the exact correct way. So your foot will be tilted according to your alignment, and in certain areas under your foot, you will have more pressure, and in other areas, you will have less pressure because of the way you're standing. So what he then did is he knew exactly where the pressure points were, and he would add some yellow page phone directory paper, and quite a few of them. He would test exactly how many he needs, and he would add them in a little masking tape packet under the specific areas where there's not enough pressure, so where there's not enough proprioceptive information moving up to the brain. So then the athletes would now walk or run on these yellow page wedges. The brain will receive the proprioceptive information from the wedges, and then the brain would use that and say, oh, I need to contract the abductor of the hip, or I need to contract this or that. So muscles that were deactivated or not activated were now suddenly activated because the brain got new proprioceptive information. So we still use the yellow page wedges after we have done all the releases. Now, I remember in the days that Ron used to come and work in my practice in the 90s, then we were not yet doing the releases of the locked bracing patterns at that time. And I remember the athletes used to walk out of my practice with very, very thick wedges because they needed a lot of proprioceptive input. But after we started to do the releases of the bracing patterns, so say now you had this muscle bracing, the agonist bracing, the antagonist would then open up. So now we're in this position. So Ron saw that and said, all right, let's give more proprioceptive input for that, and then this muscle will at least cope better and the alignment issue will not be so bad. So what I then did in Lyno eventually is I said, okay, no, but it's no use working with a weak guy. Why don't we rather release this guy? And then as we release it, this guy says, oh, great. Now, at least I can relax a little bit here and contract a bit more. And if we then add a wedge here, then it's a lot easier because we don't have that pressure from this side anymore. So this is how we have changed it around. So we've added the release of the short guy, and then it makes it much easier to get the weaker muscles, the deactivated muscles, activated. But we still use the yellow pages to activate it a lot quicker. So we give very, very thin little wedges, and we mainly use this for all our active clients, but very, very thin wedges, and they throw the wedge away normally after 2-3 days. So we just need that little bit of extra proprioceptive information. And then obviously in the end, injury prevention, because we are going to give them some homework of these are the releases that we want you to do to help create a new procedural memory that will keep you in neutral alignment, which means that you are not going to get your injuries again. So this is basically what we teach in the whole Lyno course. So the Lyno course is we do 4 intensive live modules in the Lyno course. We teach Lyno over 3 modules basically. The first module over a weekend is the linear patterns, so flexion, extension, up and adduction, so all the linear movements, 20 tests, 20 releases. Module 2, you come back 4 weeks later, and then we teach you all the difficult spirals. So all the neck, the trunk, and the leg spirals, weight-bearing spirals, non-weight-bearing spirals. So much more complicated, module 2. And then finally, module 3, we teach you the scapula and the arm and how the arm spirals interact then with the upper and the lower spirals of the body. So 1, 2, and 3 will teach you all the work, all 50 tests, all 50 releases, plus all the kind of patterns that the person would be stuck in. And then we teach in the practical course a module 4, normally about 2-3 months after we've taught module 3. And module 4 is a 1.5 full Saturday, half Sunday of case study after case study after case study, just so that you get into the whole pattern of doing the full assessment and the full releases and the homework, and just to run over it over and over again before you end up then doing your exams. So we always say where the real learning happens is not really on that weekend when we are teaching you this whole technique. But after module 1, we ask you to do 12 case studies. Now, you've already got access to the application, so you are going to select people. We normally say select 3 people that you are going to do 4 sessions with in the 4 weeks in between module 1 and module 2. So you have 3 people that you are going to see the full assessment of linear movements after module 1. You do the releases, you give them the homework, you see them the next week, and the next week. So in the end, after module 1, you do 12 case studies. After module 2, you do another 12 case studies. And then after module 3, you need to do 36 case studies. So all in all, by the time you get to your exam, you have done 60 case studies where you have done the full assessment, the full releases. You've built up a lot of clients already. You've got people talking about this already, which means that the day you write and do your practical exam, you have already done all this work. You are practiced in it. It's not like we've given you a course and now you've got to go and try and do it yourself. The day you walk out of our practical exam, we can put you into any practice and we know that you will be able to do the full proper Lyno at the highest standard and at the highest level. And this is why the case study work is actually the most important part of the whole Lyno course. And then the other thing that physios and buyers and that's always worried about, we have 61 HPCSA approved CPD points for these 4 modules. The first 4 CPD points comes from a pre-read, which is my nervous system regulation course that everyone gets a week before. It's about 4 hours of reading and you get 4 CPD points for that. Then for modules 1, 2, and 3, you will get 15 CPD points for each of those. And then finally for module 4, you get another 12 CPD points. So over a period of 5-6 months of doing these practical courses, you build up 61 points, which really is what you need for your 2-year CPD requirements. So quite an easy way of getting it, and then also getting a framework of dealing properly with all your chronic clients. Okay, so what do you receive? You receive the Lyno app. All your stuff is, all your medical records is electronically stored. It's stored in the cloud. You get full course materials. So we teach you the course over the weekend, but you also get access to our e-course, which is part of our online course, with all the videos that's on the online course. So apart from seeing everything on the course weekend, you can keep referring back to the videos with all the information and also PDF manuals. Then I run weekly Zoom sessions for all the different courses every week, and also eventually for all the practitioners every week. So I have a Lyno 1 Zoom meeting every week, a Lyno 2, module 3, a module, and then an eventual practitioner Zoom meeting as well. So there's always continuous opportunities to come and discuss your case studies, to bring new information, to help me evolve this, because we're always evolving this. And then obviously you are getting your 61 points as well. So I will be teaching this course in Johannesburg this year. As I say, I have developed the Lyno Method 30 years ago. So, I mean, I've been around for quite a while, and it came from very little testing to where we are now doing full testing on the application. We've moved from fascia manual releases. We've moved completely away from that, and we are completely into just movement and breathing. So we've evolved it so much. I've also written the book now recently. It was published now in May in the UK. I've written the book together with a professor. In 2019, I was teaching in London, and I was teaching in the UK, and I was looking for a venue to teach my course in London. And then there was the sport therapy department at East London University. And I went there and I met Professor Earle Abrahamson, who was the head of the sport therapy department at that time. And I explained Lyno to him in about half an hour, and he said, oh, wow, he must get all his people on this. Please, Benita, at the beginning of 2020, you've got to come to my university and teach this course here. And then obviously COVID came and nothing happened. And eventually I ended up going to India and teaching a lot of courses in India, etc., etc. And then suddenly, 2.5 years ago, Earle Abrahamson, the professor, he's now at another university, Hertfordshire in a university. And he then called me and said, Benita, please can we write a book together about the Lyno Method? So he said he was so intrigued by the fact that I'm always asking, but why? But why? So again, I'm asking, but why? We're in the nervous system, but why does it get activated like that? But why this? But why that? So always asking, but why? Always questioning everything, and very much questioning the way that conventional medicine deals with all these chronic injuries and chronic pain, etc., etc. So he comes from a completely academical background, and I come from a completely not academical background, but a completely practical and very innovative background. So the whole book was written on, I would write something, and then Earle would come and say, yes, but why this, why that, why that? So at the end of each chapter that I wrote, there's a block where Earle says, yeah, but I'm asking you from a scientific point of view, why this, why this, why this? And then I would answer it again in the next chapter. And then at the end of that chapter, it all comes back and say, yeah, but why this? Why? So the whole thing is about he challenges me, I challenges medicine, etc. And then towards the end, he has written a full chapter on, okay, let's take everything she has and let's take everything I have and put it all together. And then let's see where we need to go from here. So anyway, so the book was finally published now in May in the UK, and Earle is already on my back again. Benita, we've got to start writing our new book because there's a lot of new questions coming up already. So anyway, so if you buy the book, I see it's available on Amazon now, and there's an ebook as well that is a little bit cheaper than the other one. So yeah, and then Vinci is teaching the course in Cape Town. And Vinci did one of my first Lyno courses way back in Pretoria. So she's been doing Lyno for 14 years. She comes from a bio background, but she's completely in a Lyno practice doing only Lyno. She's done a lot of fantastic work on trauma and emotional trauma in the last 2 or 3 years, connecting with a lot of functional medicine doctors, working with all these fibromyalgias, etc., and getting magnificent experience there. And the doctors are so excited about this. So Vinci will be teaching this course again this year in Cape Town, and then I will be teaching it in Johannesburg. Then the investment, 18,800 for all 4 modules. You pay 3,000 deposit to get a spot on the course. Then just shortly before the first module, you pay the 1,800 to make up the 4,800 for the first course. You get the pre-read, you get the digital manuals and the PDF manuals. Just the moment you pay for your first module, the moment you've made your full payment. And then for each module, you pay just shortly before the module. So it's spread out over a matter of about, from July to November. And so it makes it a bit easier. This course, actually, if I look at it, coming now from Europe, where the courses are so much more expensive, and I believe in South Africa, the courses are also so much more expensive. So I promise you next year, I'm going to raise these fees. So if you want to do the Lyno course, do it this year because it will still be at that reduced fee. So we will be taking 20 people per course only. So if you want your place, the moment we fill 20, we cannot do more. In fact, 20 is already a lot. I'm already thinking that if I have 20 people on my course, I will get one of my practitioners to help me just with the practical work. So the Joburg course starts on the 18th of July. The Cape Town course starts on the 25th of July. If you want to enroll onto the courses, go onto the website, thelynomethod.com, and there is a book now little button that you go on, and then you send us the information, and then we will send you the invoice for that. Right, my goodness, exactly 8 o'clock. So that is that for what the book was all about, what Lyno is all about, what the courses are all about. I'd like to hear if there were any questions. I've asked Vinci if she would just send me the questions that came up. I just
Hi,
want to
Benita.
mention, hi, Vinci. I just want to quickly mention about the online course. The online course is only 3 modules, okay, because I Zoom my online people all the time. You get 49 CPD points because we don't have a 4th module. I take maximum 10 attendees per online course because all the work is very interactive, practical. So we do Zoom meetings and you sit there with your model in your room and we are working together like that. So we have the Zoom sessions, and my next intake for the online course is on the 22nd of June. And there's a special price for South Africans of 16,200. And it's also paid per module. Okay, Vinci, let me hear. Are there any questions?
Benita, there was just one question coming from Ingrid, and I think maybe you've answered it already when you talked about if you see 10 people with a hamstring injury, but her question was a specific case study for gluteal and trap symptoms that persist? So, yeah, that was the only question coming up.
Okay, Ingrid, and that's such a nice question because I get these questions in the beginning on module 1 all the time. And I'm sure Vinci also gets them all the time on module 1. So people would say, okay, now I get this. You do the full assessment and that. But now what if there is a piriformis syndrome, or what if there is a tendonitis, or what if there is a disc lesion that's showing up on an MRI or that? Doesn't matter what it is, if it's chronic, if it's been there, like you say, Ingrid, if it's persistent, then it means there's something that's feeding it. Then it means that we need to go to the full body, see where the contraction is, see what is triggering that bracing and triggering that procedural memory all the time. So we're going to ask, but why, until we get to the core of that. And once we get to the core, we can start working with, okay, the releases. So we know how to release the bracing, but we also need to find out, why are you bracing? What situation? Is it a mental, emotional situation? And how can that be changed? Not that I am going to try and be the psychologist, or that we will get other people in on the team, but what is triggering it all the time? Because if you are not going to remove the trigger, it's going to be persistent. So if there is a persistent glute or a persistent anything, it means that there is a persistent bracing pattern. And if there's a persistent bracing pattern, there is a persistent trigger, and we need to find out what that trigger is. So it's quite interesting. I mean, I'm seeing a client at the moment where she came in with extreme headaches. So she says to me she's had the headaches for about just more than a year. Since May last year, the headaches started, but in the middle of May this year, the headaches became so bad that she's had all kinds of neural blocks. She's had Botox therapy, she's had everything, but nothing is helping. And eventually now they've booked her off from work. She can't work at all anymore. Anyway, so I had a very good look at everything. And yes, there was a lot of locking in her neck, but there was also a locked shoulder. And very interesting, there was a severe lock on the front of the trunk and on the left side of the hip flexor, and then on the left ankle. But the biggest lock of all of this was not in the neck where we are expecting it. It was there, yes, but the biggest lock was in the hip on the left. And then I say to her, what happened in May? What happened in your life in May? Was it, did something move you into sympathetic like that? Or did you drop and collapse into the dorsal zone? Did something happen? And then she says, May last year, she had a very, very traumatic miscarriage. It was excessively painful while she was having the miscarriage, and she went into complete depression after that. And this year, May, a year later, so she's been having the headaches all along, but this year, exactly the same time in May, which was the birthday of the incident last year, the headaches duplicated, or they became much, much, much worse. And interestingly, then I was thinking, I wonder, this was in the beginning when we were talking, when we were doing subjective assessment. And then I started to think, if there's a miscarriage, if there's something that's happening traumatic in the lower abdomen, I think I'm going to see hip flexors, or I'm going to see rotations of maybe the hip internal rotations to try and protect, or maybe I'm going to see the abdominal, the trunk flexion in contraction. And when I did the full assessment, it's exactly that showed up. And interesting, so I started the releases in the neck, and everything released very quickly. The shoulder released beautifully. The trunk on the side released beautifully. The moment I softly, gently put my hand on the hip flexor, we started to do the breathing to release the hip flexor. She burst out crying. She went into a complete tremble, and she got a massive emotional release. So I've put her back onto the bed, covered her in blankets, and just held the space for her until that released completely and she started to calm down. And then I asked her if she would like me to do another release, and she said, yes, please. And then I started to do the abdominal, just gentle stroking with breathing, with extension of the abdominal area. And immediately it triggered again crying, severe trembling, back on the bed, back into integration, holding the space, no talking, never any talking really during Lyno, just breathing, just focusing on the area where we are bracing and reversing that bracing. And she phoned me 2 days after the first session and said, you cannot believe it, I haven't had a headache, I am feeling on top of the world, when am I seeing you again? So it's actually, the nervous system is so complicated. Chronic pain is so complicated when you start thinking of what triggered it, where did it come from? It can come from many, many years ago. As we peel the onion and remove the layers, all those persistent aches and pains and persistent symptoms start to fall away as we start to remove those procedural memories. This was a very long answer, Ingrid. When you're on my course, you will see that I always have a long answer with a lot of case studies that I add on to that. But I hope that more or less answered your question. Anything else, Vincy?
Lisa asked that she doesn't have a sport practice. She mainly works with chronic pain. So she wants to know if this will also work for her then.
Okay. So, Lisa, I think the previous answer would maybe say yes, absolutely. That was not someone coming in with a sports injury. So initially, Lyno started with sports injuries, and it was the no pain, no gain thing and the very bad stripes. The athletes used to call it the racing stripes. But we have, ever since 2019, when I was in South Korea and we started to move into Porges's work and into nervous system regulation, into the vagus work and all of that, we've actually moved so deep towards chronic pain and basically ignoring, in a sense, a bit the sport that we were focusing on initially. So a lot of the practitioners at the moment are actually mainly working in trauma. There are some of them that don't see any sport or anything like that, but only seeing autoimmune disease and that kind of situations. And because we are getting such good responses there. And actually, Vincy, perhaps you would like to maybe answer a little bit or tell them a little bit about your work with the functional medicine doctors.
My work with the functional medicine doctor basically started when a functional medicine doctor moved in next door to my office. And, not knowing what I do, I offered to give him a session. And just that one session, he said to me, well, what he does is he basically, he specializes in any chronic condition, but he's got a program that's been taken up by the Namibian medical aid, so they offer it to all their members on their medical aid, that he reverses diabetes. So he said to me, well, all his patients need this because he can't reverse diabetes when we don't address the nervous system, because it's everything is so interlinked. So since then, I've seen so many of his patients, and recently a few of these patients that he really struggled with high blood pressure. That came to my practice, and it's just amazing how, all the medication they've taken, all the diet changes and lifestyle changes that they didn't make a difference on the blood pressure. And the moment we start incorporating this, the blood pressure just responds. So there's so many amazing results that you get with any chronic, not just chronic pain, but also chronic conditions. Yeah.
Thanks. So I think, Lisa, this may answer your question there. I think Vincy ended up working with so much trauma and so many of these autoimmune diseases in the end. But again, It's quite interesting. I have done quite a few of Jessica Maguire's courses in Australia, and I'm sure some of you, if you're interested in this, would also know about Jessica Maguire's work. So she is a physio, and she does massive and beautiful courses, very expensive courses, on how to regulate the nervous system. And there's so much of that all over. I mean, once you start go on Instagram and you look at one nervous system course or Instagram page, then it just keeps coming up all the time. And it's always quite interesting. So all of them would have a lot of grounding methods, of breathing methods, of all kinds of methods to calm down the nervous system, to get it from the sympathetic into what we call the play zone, to calm it down. But none of them addresses the pattern in which the body braces up. So as Vinci was saying now, people do lifestyle changes and they go for a lot of breathwork courses, etc., which is amazing. I mean, this is why I've done so many of Jessica Maguire's workshops, and I've bought her book, etc., because that the general nervous system regulation is very important and very amazing. But if you have a very specific trigger that shows up in the body in a very specific bracing pattern, and that bracing pattern is causing chronic symptoms, then you can breathe and do any general titration work or any other kind of work. If you don't break the bracing patterns, procedural memory, in the specific way that that body presents with it. We always talk about the fingerprint. It's the bracing pattern of each and every individual, no matter if they all have the same symptoms, their bracing patterns will be like a different fingerprint for everybody. And that's why it's so important to actually find how each individual is actually dealing with the stress response. So it's good to say we're going to breathe it out, but you've got to break that specific memory, and you need to know exactly where it is and how it presents in the body and where it presents in the body if you want to do it properly. And I mean, all these autoimmune diseases or depression or high blood pressure or all these things, all of them come from sympathetic zone in the beginning, excessive cortisol, excessive adrenaline, causing excessive bracing. Excessive bracing shows up in the body and then eventually messes up the organs and messes up everything until you drop into the dorsal zone, and then you get diagnosed, and then you get all this medication, or the doctors say there's nothing more I can do for you. But so important to find your specific fingerprint, to know exactly how to reverse all this and get your body into full function. Any other questions, Vinci?
Then Sandy asked if it's possible to swap between the venues for the module, so doing one module in Johannesburg and the rest in Cape Town, or the other way around.
Yes, you can. We're actually lucky at the moment that Vinci and I are really teaching our modules a weekend apart. So I think I start with Joburg, and then the next weekend Vinci is in Cape Town with module 1, and then we move module 2 and 3. I'm going back to Dubai at the middle of September after my module 3 course, and then I'll just fly down from Dubai again for the module 4 course in Johannesburg. But yes, you can, but you have to do them in the specific order. So you cannot do module 1 and then module 3. You've got to do 1, 2, 3, 4. We do make an extreme exception of putting you on an online course. Say now you can do Vinci's module 1 and 2, but module 3 you just can't because there's a wedding or there's a funeral or there's something that happens why you can't. Then we will put you onto the online course for that module. But then you will have to speed through that online course because you will have to still make up the time to be ready for the next practical course. The practical courses are definitely a much better bet than the online courses, obviously, because you are physically working. We can see you physically working. On the online courses, I teach all the online courses. Are now restricted to 10 people on the course, and I do have you all in the little Zoom blocks every week with your model showing me, and I can say, okay, your hand's not right there, or you should do this here, or they're not breathing correctly, etc. So we are doing it as interactive as possible, but the practical course is still the best one. If you live in far away and you can't get to Joburg or Cape Town, then please come and do the online course. And if you are on the online course and you could possibly show up for one of the modules on a practical course at some point, then I'm going to excuse you off the online course and you go onto the practical course, and then you can come back on online after that again. But yes, you can move between online and practical, between venue and venue, but you have to do 1, 2, 3, and 4 in that sequence.
Okay, and then Karen asked a question related to medical aid rates. So she said, if she charges medical aid rates, how does she charge?
Okay, so Karen, if you think of it, I mean, I'm not a registered physio anymore because I teach Lyno and I do Lyno privately. But I remember while I was a physio, and all the physios that are on the that are Lyno practitioners, you can charge rehabilitation. You can charge mobilization because you are mobilizing a joint. You can charge. We can't really charge for massage anymore because we are just queuing. But I mean, you can look at all the modalities, and whatever the techniques are that we are using, you can combine those modalities and end up charging for that. Nothing that I do in Lyno is not physio. Breathwork is physio, movement is physio, assessment is physio, rehabilitation, giving them exercises to do at home is physio. So, I mean, all of it is in physio. So, I mean, you will have to just go and have a look at your codes and see how you're going to put them together. We work always 60 minutes. You can do it in 45 minutes, but at least 60 minutes. I mean, I prefer 60 minutes. So, yeah, there's more than enough modality codes that you can put together to charge for Lyno. So Lyno is not something different to physio in a sense. It's actually very similar. The only difference is that we do a full body assessment and we don't just assess one area and work on one area. We work on the full body. So yeah, any codes that would fit in with what we are doing.
Okay, and then Handley asked, do you have to do the exam at the end of the course?
Okay, so if you do not do the exam at the end of the course, then you will obviously have all the information and you can go and do it. But Lyno is trademarked all over the world so that if somebody says they are doing Lyno, they have to do it up to the standards of the Lyno Academy. And our standards are very high. So what I've done, if you do the exam, then and you become a practitioner, then you stay on the Lyno app. So you can then continue using the Lyno app. You pay a 400 Rand fee a month for all the Zooms, for all the refresher update work, for the subscription of the app, for everything, for the storage in cloud of all your medical records, etc. So all of that is included in that price. But so that when you've done the exam and you are a practitioner, you get access to all of that. If you finish the courses and you are not going to do the exam, then obviously you cannot say you are doing Lyno because you can only say Lyno if you are licensed. It's the only way that I can keep the standards of Lyno very high. And I don't have people who've done like one module and telling everybody they're a Lyno practitioner and they mess it up. So I'm very, very strict on that. So you will then obviously not have the app after that 36 case studies. We will cut the app off. You can can always still go and use your normal goniometer, your physical one, or if you have another digital one, you will know how to do the algorithms. You can make a list of all the tests that you do. And you can do it manually, but you will obviously not have access to the app, and you will not have access to the Zoom meetings every week where we discuss case studies and all the evolving of Lyno, all the new stuff, etc., etc., and that the sort of team approach of us all connecting with each other and sharing all the new information.
That's all. That's all the questions.
Wonderful. Thank you, everybody, for joining us. Thank you, Vinci, for putting the questions together for me. And I really hope that we see a lot of you on our Joburg and Cape Town courses or on the online course. Just go on the website, thelynomethod.com, and to courses. And then if you would like to enroll onto the courses, just go on book, and then we will get the information and we will send you the invoice. And then come join the Lyno team. There are lots of us. We are moving all over the world now. We've got practitioners in Australia, New Zealand. We've got in Europe. We've got no one in the UK, and we've got no one in the US. I'm looking for my first practitioners in the US. But yeah, so come and join the Lyno team, and let's solve chronic injuries and chronic pain together. Thank you so much, everybody. I hope to see you soon.
Thanks, Benita.
Thanks.